Michelle Christine, daughter, sister, mother, friend, community volunteer, Black female health professional, here to share information with my community to help empower us to live and be our best selves. Let's decide together how to live a life filled with making healthy choices for our mind, body, and spirit. We can and we will change our own health outcomes. Here we go. Let's get into Black Facts. Welcome to Black Facts. I'm your host, Michelle Christine, and this week we'll be talking about health equity with our special guest, Ms. Rhonda Smith, Executive Director of California Black Health Network. She previously served as the Executive Director of the Life Serve Youth Foundation and as the Interim Executive Director for Integrative Medicine for the Underserved. Welcome, Ms. Smith. So happy to have you here on Black Facts. So I'd like to welcome you all to Black Facts. Today's guest is Ms. Rhonda Smith. She is the Executive Director of California Black Health Network. Hi, Ms. Smith, how are you?
I'm doing fine, Michelle. How are you?
Good, good. So can you please tell our viewers of Black Facts, what is California Black Health Network?
So the California Black Health Network is the only Black-led statewide organization here in California that advocates on behalf of African Americans and Black immigrants to achieve health equity.
Okay, thank you. Can you explain to us, so you said that Black Health Network advocates for health equity. What is health equity? Like, can you explain to us in simple terms, what is health equity?
Right. So health equity is when there is fair and just opportunities for all of us to, no matter where we live, what we look like, how much money we make, who we know, have access to have the opportunity to live a healthy life. So it shouldn't matter like what type of health insurance you have or like what color your skin is. When we go see a healthcare professional and seek out healthcare, we should all be treated the same based on our needs and not necessarily based on some preconceived notion about who we are, where we live, or what we may do, or how well educated we are. Because we see that, when it comes to racial bias within the healthcare system, it doesn't matter what your education level is or your income level. Unfortunately, the disparities are the same, right? What we see across the board.
So you told us what Black health equity is. Why is this important to our community and why should we care?
Yeah, because unfortunately, when it comes to all diseases, whether it's chronic diseases or cancer, Black folks unfortunately die at a disproportionate rate compared to the benchmark is typically the Caucasian population, but unfortunately we are at the top of every list from birth to death. So when it comes to maternal health and infant mortality, and even to what happens when it comes to end of life, whether it's palliative care or hospice care, those conversations and what we have access to in terms of treatment or resources, it's very different. And so unfortunately here in California, if we look at an aggregate number, the life expectancy of Black Californians is it's the least and the shortest compared to all racial and ethnic groups. Then when we talk about Black men, when you get to a more granular level for Black men, it's even worse. And unfortunately, even though overall life expectancy has improved, when we look at what has decreased, relatively speaking, since World War II, that has not gotten any better for Black men in particular.
Wow. So now we understand why it's important. Now, can you explain to us how we can go about advocating for our own health equity?
Yeah, so it's, now is the time, right, for us to speak our voice. And
yes.
How we look at health equity at the California Black Health Network is it sits at the intersection of racial justice, social justice, and environmental justice. And so, we've all been glued to the TV over the past few months or year now, what's happened kind of in all those areas, definitely when it comes to racial and social justice. And so just speaking up when we see things are things that are wrong being done to people that we know and care about. And even sometimes when we go to an appointment with our family member and we see how that provider may be treating or talking to or not listening to our loved one, you can speak up. You have the right to ask questions. You have the right to, know what your options are and what resources out there available to you, especially if we're talking about serious illness like cancer. And if we're talking about a stage 4 cancer, often I see women and hear women, because I'm a breast cancer survivor, so I know a lot of survivors. And sometimes when we're a stage 4 Black woman, it says, I'm sorry, there's nothing else I can do. There's no treatment for you. But I see a lot of women who are metastatic breast cancer survivors, who are white women who live 10, 15 years, but I very rarely see an African-American or Black woman in the same situation. And so I think if we're well informed and are more health literate, then we know that, hey, if that doctor's saying that, like, what about a clinical trial? Know how we feel about that as a Black population, but it is an option and could be a life-saving option for some women. But oftentimes, unfortunately, we're not offered, or we don't have those conversations. And the doctor who's taking care of us, unfortunately, often does not engage in or initiate those conversations about other options.
Thank you for tuning into Black Facts. Together we can and we will improve our own health outcomes and that of our community for future generations. If you have any questions or suggestions on show topics for Black Facts, please be sure to email us at blackphacts@gmail.com. Don't forget to subscribe to Black Voice News YouTube channel for more great content. Join me on the next episode for another engaging conversation and know the facts.
Black facts, talking about black facts. Black facts, talking about black facts. If there's a problem, we can solve it.